Hey mama, in today's video I'm going to be going over everything about inductions. That way you can make sure that you have enough information to know whether or not being induced is right for you. My name is Caitlin Stowe and I am a certified childbirth educator as well as a birth doula in Santa Cruz, California, and I can't wait to dive into today's topic with you. Okay, so what is induction? So induction is the process of initiating labor when your body hasn't gone into spontaneous labor, meaning labor on its own yet. So you could be induced for a number of reasons, including elective inductions or medically indicated inductions. So an elective induction can be done for a few different reasons. One of the most common reasons is just because you're approaching your due date. In fact, this is about the reason of half of all inductions is just because mom is getting close to the due date. So most OBs will actually end up asking mom if you would like an induction around that like 38 to 39 week. Another reason could be because of maternal age, so if mom is over 35, or if mom has gone through fertility treatment. So sometimes this can be kind of fear-based reasons. Your doctor might tell you that you'll want to get baby out, and the further you go, the more risk that baby could actually die if you wait, or if you've had a previous stillbirth or infant death. These are the most common reasons for an elective induction, meaning again, it's not necessarily a medically necessary induction. So with that being said, if you're thinking about an elective induction for any of these reasons, I would love for you to, one, research all of these topics and whether or not you think that it's necessary. So if you fall into the category of being 35 or older, having had fertility treatments, then look up research on whether or not you think that this is a necessary thing for you. Your answer could be completely different than someone else's answer who is wanting to be induced for the exact same reason. So make sure that you are doing your research on these topics. A website that I personally love is called Evidence-Based Birth. Evidence-Based Birth will go into these exact topics. So for example, say you are 35 and older and your OB is pushing for an induction. Go to that website and start researching all of the information for risks. They will give you all the information for trials and where they came from, because we really want to be looking at who's funding these trials, where they're coming from, who's involved in these trials. So they will give you just completely evidence-based information, no opinion here. You can also start researching positive birth stories of people who have not had an induction with these topics, and just start getting familiar with what an induction entails, as well as if you think that it would be right for you based on listening to stories of moms not being induced. The other thing that I want to mention here is that babies and your body are smart. They know exactly what they are doing. So if you find that you are just wanting to be induced because you are getting further along in your pregnancy and you might be uncomfortable, I would love for you to do research on the risks of an induction too. Again, I'll go into detail a little bit more in this video, but also the benefits of just starting labor spontaneously and the benefits of being induced if you think that that is something that is right for you. Okay, so now I want to go into some reasons for a medically indicated induction, and I want to start by saying it's probably not proven as an emergency, because if it was an emergency, you would probably go straight to an emergency C-section. So we can kind of break these into the category of non-urgent and medically indicated, or if it's an urgent and medically indicated situation, again, life-threatening for either you or your baby, it's most likely going to be an emergency C-section and probably not an induction. And the reason I say this is because inductions can last a really long time. So you can be trying to have an induction, and if your body is or your baby is not ready for it, you can be in the hospital for days at a time, slowly progressing in labor with an induction. So again, if it was a true emergency here, they're probably not going to have you go into a situation that could potentially take days for baby to come out. We can have non-urgent reasons for an induction, and some of these reasons would include you're past your due date, your water has broken and you're not immediately in labor, the baby size, So this could mean that baby potentially is too small or too big, if you've had a high blood pressure reading or gestational diabetes, but many other reasons exist. So your OB or you could be wanting an induction for plenty of reasons here that again aren't necessarily urgent reasons. And what I would like for you to do is do your research, make a plan for these things. So I personally had gestational diabetes, and I'll make another video with my full induction birth story because I did get induced with gestational diabetes. But if I had done my research, I personally would have chosen not to be induced. But I didn't know because my OB was telling me that my placenta was going to fail with gestational diabetes and that baby was looking to be too big or potentially too big, and in all reality my placenta was just fine. It did not fail. I could have checked on my placenta if that's what they were worried about, and my baby was born at 7 pounds 10 ounces. So not necessary by any means. And again, if I had done my research beforehand and just not blindly trusted my OB, I definitely would have changed my mind on whether or not I had an induction. So again, look at evidence-based birth, listen to podcasts, look at other stories. I did end up looking at evidence-based birth for all of the reasons to get induced with gestational diabetes, and I personally weighed that it wasn't important to get induced with my gestational diabetes that I had personally. So you could have a completely different opinion, which is perfect because that is your birth mama and you are in charge. So if you're being pushed to be induced, do your research and see what you feel comfortable with being induced if you do think that it is a reason and is necessary to be induced, because you do have that power to totally make that choice. I'm going into medically necessary inductions. Again, necessary is really a relative term for you and what you think is a necessary reason to be induced. But some of these reasons can be true preeclampsia or eclampsia. So sometimes doctors will just send you in to be induced for a high blood pressure reading or having a few high blood pressure readings or a couple of symptoms of preeclampsia paired together. Listen to your intuition and whether or not you think is something wrong and you think that it's necessary to be induced. There's something called HELP syndrome, something called cholestasis, or there are, again, other reasons, but these are the most popular ones that I'm going over. So here are your options when your provider recommends an induction. You can either consent to the induction, you can refuse the induction, you can ask to delay the induction, or you can ask for your induction methods and go over a different induction method than what your provider is recommending. Speaking of different ways to induce, there are hormonal methods, manual methods, or there's more holistic or natural methods to inducing labor as well. There's 3 typical hormonal methods of inductions that your provider will use, and that is Pitocin, or can be referred to as synthetic oxytocin. I'm going to explain in a little bit further detail what Pitocin is and what it does. I'll first talk about oxytocin. So oxytocin is generally a super important hormone in labor. I have talked about oxytocin before in previous videos and in a little bit more in depth on my Instagram. But oxytocin basically naturally is produced in your brain, and it helps labor progress by producing contractions and making sure that mom stays in basically a feel-good state during labor. Oxytocin is released in waves and pulses during early labor, which will then lead to uterine contractions. And as the contraction causes the cervix to stretch, those stretch receptors then send the signal to the brain to make more oxytocin, and it ends up being one continuous oxytocin feedback loop. So this cycle just keeps happening over and over again, which essentially helps labor progress while helping mama stay in that mental feel-good space. So oxytocin can also lower pain levels, lower stress, lower blood pressure, and increase feelings of safety and bonding with baby and breastfeeding when baby is here. So now let's talk a little bit more about Pitocin, which again is the synthetic drug version of oxytocin. So Pitocin is supposed to mimic the effects of oxytocin when administered and given to mom, but it forces the uterus to contract during labor. Because it forces the uterus to contract, it can actually disrupt the normal physiology of labor. When in labor, Pitocin does not pass the blood-brain barrier, meaning the body does not produce those natural endorphins endorphins and release natural oxytocin. So we're not getting that same continuous oxytocin feedback loop that you would be getting if you weren't given Pitocin. Pitocin can also create harder and stronger contractions, which can be a little bit more difficult to manage and put more stress on the uterus. So if you've talked to moms or listened to birth stories of moms getting Pitocin in labor and being induced that way, you might hear that Pitocin contractions are stronger and harder to manage than regular contractions. And again, this is just because it's the forced contractions of your uterus, so the uterus can get a little bit hyperstimulated. So with that being said, that is one of the risks of using Pitocin, is the uterus being hyperstimulated, which then can cause potential fetal distress or abnormal fetal heart rate patterns, as well as low oxygen to the baby. More risks is that using Pitocin can actually lead to more interventions being used during labor and can end up in a C-section, as well as headaches or potential uterine rupture. But that is a low percentage of a chance of uterine rupture. You can do your research on those specific risks and see if you think that it's worth it to you. But as far as benefits of using Pitocin, is that it does work, and it can be potentially beneficial in helping the body just slowly go into labor if it's necessary, which can then hopefully reduce the risk of that hyperstimulation and all of the risks that come with that. So the good thing about Pitocin is that it can be turned up or turned down while it's being used. And it would be great to be able to turn down Pitocin if the contractions start to come on too fast or too strong. Or it can be just turned down or just not being used at all anymore once the cervix has reached between 5 to 7 centimeters dilated, as it's not necessarily needed at that point anymore. Pitocin can be used again for an induction or augmentation, which is basically means that labor has already started naturally, but your provider might want something to kind of help labor continue, which might not be necessary. So do your research, listen to your gut on that. Pitocin can actually also be given in the 3rd stage of labor to help control potential hemorrhaging. And I'm going to talk about our 2 other methods, which are Cervidil, or can be referred to as prostaglandin, or talking about Cytotec, which can also be referred to as misoprostol or miso. So both of these options are used to start labor and start ripening the cervix. So we'll go a little bit more in depth into Cytotec or misoprostol first. So Cytotec can be taken or can be administered vaginally or orally. Cytotec tends to work a little bit quicker than Cervidil does. That could be a potential benefit for mom. Usually if you are taking this orally, it'll be just given in a pill that you will just take every few hours in small doses. The main risks of Cytotec are fetal distress, hyperstimulation of the uterus, uterine rupture, or placental rupture. Then I'll go a little bit more into Cervidil. So Cervidil is inserted vaginally, either through a tube that is inserted into the cervix or via a gel that is smeared on the cervix to be absorbed. So typically you're given a 1 dose every 12 hours or so. And the risks of Cervidil are pretty similar to your other risks, which could be fetal distress, hyperstimulation of the uterus, uterine rupture, placental rupture, or just some gross side effects like nausea, vomiting, or diarrhea. So Cervidil tends to mimic the natural prostaglandins that are in the body to help soften the cervix. It can also easily be removed. It can also cause a slower induction process, which is a good thing for moms, so that way the body can potentially have a little bit more time to adjust as labor progresses. So there are also manual ways to induce labor, which you might have heard of a foley balloon, which is essentially a balloon that is inserted into the cervix and then filled with saline, so that way it ends up putting pressure on your cervix to start to dilate. Membrane sweeps can be another way to induce labor. A membrane sweep, essentially your provider will insert fingers and will basically like sweep along the space from your amniotic sac and your uterus to create more space to separate the two. This will sometimes start labor, but not always, as well as actually with every single method that I'm talking about, whether it is a hormonal, manual, or a more natural way of induction. So if your body and your baby aren't ready to be induced, sometimes these methods won't actually even work. And then the last way of manually inducing labor would be your provider breaking your water. More natural versions of induction could include different herbs or things that you can take, eating certain foods. There's something called a mile circuit, or walking up hills, induced labor, or nipple stimulation. Again, these things can all happen before you're trying to induce labor, even if you're not wanting to induce labor, and your body will not go into labor if it is not ready for it. One of the things that I want to share with you and make sure that you know about is something called the Bishop score. The point system is from a 0 to 13, and the higher the score, the more likely your induction will be successful at getting labor to start. The way that they determine this score is based off of, essentially, to get your score, your Bishop score, your provider will examine your cervix and look for the consistency, so the actual feeling of your cervix, how hard or soft it is. They'll look at the dilation of your cervix, how open it is. Then they'll look at the effacement of your cervix, how thin it is. And then they're gonna look at baby's positioning and baby's station, which is essentially just your baby's location in your pelvis, how far up your baby is or how low your baby is in the birth canal. So if you score less than a 6 on the Bishop score, the induction should usually start with a cervical ripener, help soften and open the cervix, and this cervical ripener is typically either a foley balloon, Cervidil, or Cytotec. If you score higher than a 6, the induction will begin with Pitocin in order to encourage the uterus to have consistent contractions that will open up the cervix. So if you're given Pitocin before 6, you can end up increasing the risk of more interventions and actually a C-section. So it is always a good idea to ask your provider what your Bishop score is. That way you can make more of an informed decision on how successful your induction will be. Questions to ask your provider, like, am I at risk if I don't induce right now? And what is at risk? So what are the risks for baby? And then also do your own research. Like I said beforehand, in my situation, I asked that when it came to being induced with my gestational diabetes, and the risks my provider gave me were actually risks that I was okay with and I didn't see as medically necessary looking back on it. So do your own research. I always encourage mamas to do that. You can ask, do I need to drive to the hospital right now to be induced? See what they say. See how much of an emergency they think it is, whether or not you can wait a little bit. And just to remind you, you can always wait or just not be induced if you don't want to be. And ask what the Bishop score is. Is it a 5? I don't want to be induced right now, and that is totally okay. You are the center and the authority of your birth. Whatever you feel comfortable with and what you want to do, mama, is okay, and it is up to you. Ask questions, talk it out with people, because pregnancy is hard, especially the end of pregnancy, and with having an induction being something that's on the table basically at all times from when you hit that like 38-week point. Do some reflecting, do some journaling, see how you're feeling, and whether or not you think that an induction is something that is beneficial or would be beneficial and necessary for you, because again, there are risks when it comes to induction and a higher chance of any type of intervention. So if you're someone who's not wanting an intervention or wanting a low intervention birth, then I would really analyze why you want to be induced and see if it's something that's necessary for you. And sometimes the answer for moms is yes, this is something that I definitely want to do, and other times it's not. So just make sure that you know ahead of time where you're at, what your risks and what your benefits are, and weigh them both. And I'm just saying this is coming from a place of someone who did be induced and wishing I had someone tell me that I had other options if I just researched it and listened to my gut. With that being said, again, know your benefits and risks, know all of your induction options. Never be afraid to ask questions or see if you can put your induction on hold if that's something that you would like to do. I hope that this helped you learn more about induction in general and see if it is the right fit for you. I will see you in the next video. Bye.